and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, October 29th. I'm Danelia Mitchell. I'll be your moderator for today's lecture, Medications and Aging. Before I present to you the wonderful speaker joining us today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we can all have a great conversation about how aging affects medication use and how to keep safe while using medications. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which also allows us to host a good number of people who join us via phone. Thank you so much for joining us. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenter. And for those of you listening to the discussion via phone, you will also have an opportunity at the end of the presentation to unmute your audio so that you can ask your questions. We'd like to remind you that all information offered here is for general information purposes only, and to always seek additional professional advice for situations specific to you and your needs. And now I would like to introduce our speaker, Dr. Varisha Singh. Dr. Varisha Singh is a geriatric medicine fellow at Rush University Medical Center. She completed a family medicine residency in Michigan at Henry Ford Genesis. She is passionate about preventative medicine, mental health, social justice, and social media use in medical education. Thank you, Dr. Singh.
Hi, thank you so much for having me. I'll just go ahead and share my slides. Okay, so today we'll be talking about medications and aging. This is a very important topic. It comes up every single day. We have patients who are either started on new medications, stopped taking medications, or find themselves in a position where they don't know which medications to take. So we'll just be discussing the importance of knowing your medications, and how to actually ask your medical providers about your medications as you see your different specialists. Okay. So in this presentation, I'll be covering how aging affects medication use. As we age, our bodies change. How we absorb, use, and clear medications changes too. We'll also be recognizing some high-risk medications. Many older adults take multiple medications, often from different doctors, and some of those medications may be classified as high risk, meaning that they may have more side effects than a usual benign medication. And the goal always is to have the right medication at the right dose and for the right reason. And then the next thing would be to learn strategies to improve medication safety. Because as we know, misuse or overuse of medications can cause confusion, falls, and hospital visits. So medication use is rising over time. More patients are ending up on more medications. So there's nothing wrong with taking medications that help you to live better. But as we age, the way our body handles those medications also changes. And that can turn something helpful into something risky, especially when multiple medications interact. So my goal today isn't to scare you, it's more to empower you. I want you to feel like after you've heard this lecture today, that you're more confident to talk with your doctors, your pharmacists, your families about your medications, because at the end of the day, knowledge is one of the best medicines that we have. And knowing more about your medications and why you're taking specific medications is just empowering to you as a patient. So, what is polypharmacy? It's a fancy word, but it simply means taking five or more medications at once. Um, And you may be taking medications for very good reasons, like blood pressure, diabetes, arthritis, um, sleep, pain, or mood. Um, but when we combine them, especially with vitamins and over-the-counter products, things can get complicated. So when we say that polypharmacy is taking five or more medications, that includes supplements and over-the-counter medications as well. So when you count the medications that you're taking, it would be medications that have been prescribed to you by a doctor or medications that you take on your own, that you may just buy from the pharmacy over the counter. So, the more medications that you take, the more chance of side effects, which could lead to things like confusion, falls, and hospitalizations. Many people see many different specialists, so you're getting medications from multiple doctors, as well as the over-the-counter medication. And all of these sources add up to that final number. So it is common, polypharmacy or using more than five medications is very common. About 4 in 10 older adults meet this definition of polypharmacy. And like we spoke about, adding medications can increase the risk. Um, and it's very important to look at your medications and decide if a medication is causing a side effect. Are you then taking a different medication to treat that side effect? Um, which is kind of like a cascade where you're taking one medication to treat a side effect where we could have just stopped that medication giving you the side effect. Um, so very important to think about. Okay. And then some common medication concerns in older adults, polypharmacy, like we spoke about, drug-drug interactions, how, each drug is processed in your body and how that can interact the processing of a different drug, adverse drug reactions, so just the side effects from these medications. And then something that I think doctors may overlook a lot is patients not taking medications or not adhering to their medications due to cost or complexity. You may find that a certain medication is just too expensive to take. Share that with your healthcare provider because they may have a suggestion for an alternative that may be cheaper. Um, so I would definitely say to watch out for side effects. Sometimes the hardest part about aging and medications is that side effects can often look like aging itself. You might feel more tired, more dizzy, more forgetful, or unsteady on your feet. And we could often say, okay, I'm just getting older. But sometimes it's not age at all. It could be the medication side effects. Um, so the next time you feel off balance, dizzy, or foggy, don't just assume that it's part of getting older. Ask your doctor, could one of my medications be doing this? Um, it's always a conversation. You never, start a medication. There are very rare times where you start a medication and take it lifelong. Things change, your body changes. You may need to adjust either the type of medication or even just the dosage of the medication. Um, Sometimes one small change, like lowering the dose or switching to a safer option can make a huge difference in things like your energy, your clarity, and safety, which is the main concern. So other side effects to look out for would be like constipation or urinary retention, loss of appetite, or weight loss. And then, of course, balance issues leading to falls, all of those kind of come together as very serious side effects. So, what are the changes that your body undergoes as you age? Um, so, when you're younger, your liver and kidneys are your body's detox stations, and they clear the medications. And, as you age, they may not be clearing those medications as quickly. So clearing those medications out of your system takes a bit longer, and the drugs basically stay in your system, and the effects of these drugs stay in your system for a longer time. So along with the benefits come the side effects that will also stay on longer. Um, Other changes are we also lose muscle and water, and you may gain a bit of fat or lose a bit of fat. And the way some medications work is they may be dissolving in different types of fat and could be getting trapped in fatty tissues where they release slowly. So it's very important to speak to your doctor as they would know about the metabolism or processing of these medications. And we want to make sure that they're not getting trapped or stored in fatty tissues or getting too concentrated in the water content of your body. Um, I like to think of it as, your body is like a car engine. When it was new, it burned fuel efficiently, but now that it's getting a little older, it still runs well, but it needs a different kind of care or a gentler touch. Um, so, if you're ever wondering, why is my doctor lowering my dose of a medication that I've taken for years? It's not because you're necessarily weaker, it's because your body is just wiser and needs a smaller amount to do the same job. That's how I would think of it. Um, and a good thing to remember too is that more medicine isn't always better. Sometimes it's more risky. So, you may be more sensitive to a certain dosage of medication. So specific medications that I think are notable and deserve extra caution in older adults, and your doctor might call them high risk medications. These are things like the sleep aids, like Tylenol PM, Advil PM, or Benadryl. These contain a medication called diphenhydramine, which can cause confusion and memory problems. Um, Things like anti-anxiety medications like Valium, Ativan, or Xanax, um, especially in older adults, they can linger in the body for days and increase the risk of falls. Um, and certain muscle relaxants too, certain pain medications can cause you to become dizzy and constipated, especially opioid medications, when even when they are prescribed, must be like very carefully balanced, especially when you're combining it with something like a sedative. So, once again, doesn't mean that these drugs are bad. I don't like to label drugs as good or bad. It means that they're just riskier for certain people, and we should be reviewing them and regulating them, every time you see your healthcare provider. Um, and again, if you're taking one of these medications, I would not stop them suddenly. A lot of these medications can have withdrawal, which is very dangerous as well. So I would first speak to your healthcare provider, ask them questions like, is it still safe for me to take this medications? Is there a safer alternative? Is this still right for me? Can we lower the dose? Um, those conversations can prevent something like a fall or a hospital visit. So I think that's very valuable to have. So some tips for medication safety. Medication safety starts at home. So, taking your medications at the same time each day is not also a good way to remind yourself to take the medication. Um, but it also is metabolized differently at different times of the day. So that may be the preference for most medications to be taken at a certain time of the day. Obviously, storing your medication is also important. Storing it in a cool, dry place, so away from humidity and heat. So I would avoid keeping medications in the bathroom. Maybe keeping it next to, where you make your morning cup of coffee, maybe a better idea. And then obviously never mixing your medications with alcohol unless it's been cleared by your doctor. Um, Alcohol is also processed by the liver, and it may either stop certain medications from being processed quickly or may process them too quickly. Um, so always a good idea to ask your doctor about that. And then if you notice any new or worsening symptoms like confusion, dizziness, constipation, rashes or swelling or urinary changes, reach out to your provider, especially if it's a new medication that you've started. We don't know how your body will react to that medication until you've tried it. So reach out to your provider, let them know what side effects you're experiencing, and don't wait. Just call early and have it checked out. And if you need to go to the emergency room, that is also a very reasonable thing to do. So things that you can do, um, you're in charge of your health. You're in charge of what happens to your body. And the first thing would be knowledge, is educating yourself on your medications. Keeping an up-to-date list of all your medications. Write down every prescription, vitamin that you're taking, supplement, and take it to every appointment. Especially if you have different specialists, different providers in different medical systems. Sometimes the medical record is not connected, and your kidney doctor at one hospital may not use the same system as your primary care doctor in another system. So making sure that you have the list is the first step, and your provider can go about reviewing your chart to make sure that everything matches up. Um, and then I would also recommend using one pharmacy if possible. That way, your pharmacist is also tracking all your prescriptions and can spot interactions early. Um, Other things, using a pill organizer. This can prevent missing doses or doubling up on doses. Um, Having it, clearly marked with the days of the week, and evening, morning and evening as well, just so that you know that you've taken that medication for the day. Um, and once again, just it is an open conversation, asking your doctor, do I still need this medication? Why am I taking this? What happens if I miss a dose? When should I stop a medication? So, of course, there are medications that are very important for chronic illnesses that you will need to be on for an extended period of time. But some other things for more acute conditions, such as pain, if you're treating pain, how long should you be taking pain medications for? All very important questions to ask your doctor. Um, and I think my response would always be, it depends on how you're feeling and how your symptoms improve. But for more high risk medications, there is kind of, you know, a shorter time period that we're comfortable having you on those medications. Um, and how can your geriatrician help? So, as a geriatric provider, my job is not just to add medications. It's to make sure that each one still makes sense. So, aging changes everything. The way we eat, the way we move, the way we sleep, and the way we respond to medications. So that's why we do medication checkups. It's to adjust doses, remove duplicate medications, and just ensure that each medicine has a clear purpose. We also try to look for safer alternatives. The first step would always be using lifestyle changes or non-drug therapies before reaching for another prescription. Um, I think in an ideal world, we would, be able to implement lifestyle changes more broadly. But the reality is that patients usually don't have the time to wait for the lifestyle changes to kick in. Which doesn't mean that we can't implement them. It just means that maybe we implement the lifestyle changes while starting a medication and then later cut back on that medication. Um, so things change and your medication should change with you. So think of it like spring cleaning for your medicine cabinet. Something that worked maybe 5 years ago may no longer be like the best fit for you. Okay. And the most important message that I want you to take home from this is that you are part of your healthcare team. You should feel empowered, to be able to ask those questions and be part of the team making decisions about your health. Only you know how capable you are of managing these medications at home or how capable you are of managing a lifestyle modification. So, definitely let your doctor know if you're feeling uneasy about a medication, not sure if it's the right fit for you. Speak to your doctor. And every time you see them, they should be looking through your medications and making sure um, that, you are taking the appropriate medication. Um, and aging doesn't mean losing control. I think it actually means taking charge with the wisdom that you already have because you have known your body this entire time. You know what works for you. So work together with your doctor, your pharmacist, your family, just so that you can stay strong, sharp, and safe. And at the end of the day, the goal isn't to take more medicine, it's to live more life. So that is my takeaway message, and thank you so much for listening to me. I think we'll open for questions now.
Yes, thank you so much, Dr. Singh, for that valuable information. I've learned so much today, so thank you. And we will open it up for questions. If you are on the phone and have a question, you can press *6 to unmute.
Hello?
Yes.
Yeah, hello?
Hi, we can hear you.
Oh, I'm sorry, I didn't know. Peter, yeah, excellent presentation. My problem is I'm taking, it's a tamoxifen for urinary issues and famotidine for stomach IBS issues. If I take them, it helps the stomach and it helps and also Tylenol for aspirin, which could hurt the kidneys. So one thing can help but hurt. It could cause dizziness, but yet the famotidine, but it also helps the stomach. So I just can't get a perfect balance on it. Is the problem.
Yeah, that is definitely a difficult combination. I would definitely reach out to your doctor to, speak about
Hmm.
these concerns and see if there's something different that
Yeah.
they could do for that.
Well, they
Um,
can't discover dizziness. I've had that for 2 years. There's no cure. My heart is fine. It's something else. Verticular. What do you call that? It's not vertigo. I don't know what it is. They don't know what it is either. The
mhm.
dizziness. I'm
Yeah.
74. Yeah, that maybe I'm getting older.
Yeah, it may be something that we could do with your medication. So, speak to your primary care doctor about
Right.
the concerns. Definitely,
Mm-hmm.
yeah.
Okay. Thank you.
Thank you.
Thank you. Do we have any other questions on the line? *6
Yes,
to, okay, great.
I just I just wanted to ask her to repeat. Did she say that some medications could affect the urinary tract, the way
Mm.
you affect your urine
Yes,
from
yeah.
the bladder?
Some side effects of medications that maybe you take for either like sleep or allergies, can have like uh, a side effect where it causes like urinary retention. Um, so definitely, ask your doctor about that before they prescribe you any medications. Um, which medication, if you're experiencing some urinary retention or urinary symptoms, definitely let your doctor know that that's what you're experiencing, and they can look at your medications to see if there's a cause for it.
Okay, thank you.
Thank you. Any other questions from the phone? Okay, we have a question from our YouTube watchers.
Mhm.
The question is, are there lifestyle changes they can make to reduce the need for medication?
Yes, yeah. I think it is dependent on what medications you're taking and what you're taking them for. The very big obvious ones are high blood pressure and diabetes, type 2 diabetes. Those go hand in hand with uh, lifestyle changes, and you can actually see a decrease in your blood pressure and your blood sugar levels with simple changes to diet and moving your body more, exercising more. Of course, there's some conditions where lifestyle changes may not work out and there's no way to avoid taking medications. But I think of, easy ones like weight gain, high blood pressure and diabetes, which, using diet and lifestyle modifications may even help things like arthritis. So speaking to your doctor about those, and maybe coming down on some of those medications. I've seen a lot of patients who were able to eventually get off their blood pressure medications just by doing some lifestyle changes. Um, it is definitely difficult to change the way you eat, but it is possible. And maybe it's just about one or two things in your diet that you're changing. It doesn't have to be a major diet change. I never recommend that because that's not in the long term, it never usually pans out well. But making small changes over weeks can actually affect your blood pressure in a good way, as well as diabetes.
Thank you so much for that. And the second question is, how do you distinguish if you're experiencing a side effect of medicine or if it's normal aging?
That is a good question. I think firstly, knowing the onset of when it happened, um, and being very aware of how your body feels. That's the first thing. You are like very much in control of that. And then if you're noticing a specific symptom, bringing it up with your doctor, and they may say to you, oh, yeah, that is a common side effect that we see with this medication. They could recommend, changing the medication to see if you feel better after that, or stopping the medication. Um, or they may say, yeah, I don't think that's really a side effect that I've seen with that specific medication. Maybe we should look into something else and work up the problem that you're facing. If it's something like fatigue, there's a lot of things that can contribute to that. So, getting a good new set of labs, making sure that everything is up to date as far as your screening and labs would be the first step. It is a very nuanced topic, and I think your primary care doctor or whichever provider knows you best, I would go to them with that question too.
Thank you. The next question, what are some strategies or programs that can help overcome barriers to medicine if the cost is too much?
Yeah, that's a great question. I would, in our geriatric clinic, we have a social worker who helps with cost and making sure that patients feel like they have access to medications. So definitely reaching out to a social worker. They have a lot of good resources and can help you like pay down medications too. And, again, making your doctor aware that, I don't think I can afford this medication. It is our job to then look for an alternative that you could be able to afford. Um, so yeah, just social worker would be a great first step.
Thank you. And we will talk a little bit about our social work services at the end. So stay tuned. And the last question, someone mentioned, they said they thought they read that one should avoid muscle relaxants, that they're not helpful. Is that true? If that is true, is there a safe alternative one can take for muscle pains and aches?
Yeah, the we like to practice evidence-based medicine, and a lot of the evidence shows us that muscle relaxants um, don't cause muscle relaxation as much as they kind of just make you sleepy, um, and falsely, unaware of the pain maybe. So they're not a great medication when it comes to the risk versus the benefit. You're not getting as much of a benefit with like the high amount of risk that there is with like drowsiness, confusion, falls. So I would say a safer route for muscle pain would be something topically, something like a Voltaren gel or an icy hot, and then doing, if it's safe for you, like your Tylenol and your NSAIDs, would be, Tylenol, Motrin would be my first go-to for muscle aches and pains. But definitely look into something topical, because the nice thing with those is that they're not absorbed into your system. So they are in the same family of medications as Motrin. So it is an NSAID. And if, you are someone who can't take NSAIDs, you will still do okay with doing a topical NSAID. So looking into those medications more would be my recommendation.
Thank you so much, Dr. Singh. And thank you for your wonderful presentation and answering all of our questions.
Thank you for having me.
Okay, so we are going to talk a little bit about our current and upcoming Rush Generations programs. We have our Take Charge of Your Health, which is a free 6-week workshop for people with ongoing health conditions. People learn how to build skills to gain confidence, better manage their health, and lead a more active life. Over the course of the 6 weeks, you will discuss goal setting, nutrition, physical activity, medication, and pain management, effective communication, and strategies for working with your healthcare professionals. So, as Dr. Singh mentioned, preventative health and taking care of your health, these are great programs that can complement what you are already doing. The next workshop will be held in person at the Rush campus on Tuesdays, starting November 4th through December 16th from 9:30 until noon. You can give us a call at 800-757-0202 to register. We also have Learning to Live Well with Chronic Pain. This is a telephonic toolkit. It's a free 6-week workshop for people living with chronic pain that takes place over the phone. This group engages participants in discussions and skill building activities to better cope with the day-to-day management of chronic pain and do more of what matters to them. Sessions include wellness, action planning, problem solving, exercise, nutrition, strategies for medication management, pacing, activity and rest, and communication with family, friends, and health professionals. This workshop will be held on Mondays from 10 a.m. to 11 a.m. over the phone. The class runs from November 10th through December 15th. Again, over the phone, and you can give us a call at 800-757-0202 to register. And our Shaman Senior Voices. Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and your loved ones. Shaman Senior Voices wants to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/shaman/collaborate and connect. Again, that is aging.rush.edu/shaman/collaborate and connect. Or scan the QR code to record on a mobile device or smartphone. And our next lecture, Understanding and Managing Diabetes, will be held Wednesday, November 5th at 1 p.m. Again, we thank you for joining on today. Also, if you have any questions regarding social work services, we have social work services within our department of social work and community health. You can also call our 800 number to get connected to a social worker. Again, 1-800-757-0202. Thank you again for joining today.